Good afternoon. My name is Corina Herrera Loera, and as many of you who've tuned in before know, I'm the Public Information Officer with the Emergency Operations Center here today, hosting our In Conversation with the County. Today we have great speakers coming up for you, but before that, I'm going to give an update. Just stay tuned. We do have Dr. David Putney. He's an Administrator of Special Projects, Office of the Superintendent at the Santa Clara County Office of Education, and then we will also have Dr. Hilaria Bauer, who is the superintendent for the Alum Rock Union Elementary School Districts. Before that, we're going to go ahead and give our update for the County of Santa Clara. Thank you for joining us. Next slide, please. So our daily update as of August 2nd is 227 new cases, and that's our 7-day rolling average. As of August 2nd, we had 84.3% of our 12 and older with at least one vaccine dose and 78.2% of our 12 and older who completed the vaccination. Next slide, please. These numbers, as I mentioned, the 84.3 and the 78.2 earlier, what I want to highlight on this slide specifically is our Hispanic Latino numbers. Although the county as a whole, we're at 84.3 of at least the first dose, which pat on the back for our entire county. That's a great number to be at. However, communities like our Hispanic Latino community, we are still at 64%. What does that mean? That means that our communities, such as the Hispanic Latino communities, still are at a much larger risk, and we still have a lot of work to do because, as we know, the Delta variant, which is COVID, and the Delta variant is a lot more contagious. And those that are not vaccinated are getting stronger symptoms and unfortunately ending up in the hospital versus those that are already vaccinated are not ending up in the hospital and have very mild symptoms. So there's still many community members who are not vaccinated, and those are who we are most concerned of at this time, including the reason why we have a mask update. We've updated our mandate to wear masks indoors because not everybody's vaccinated, and then also not to mention our children who are 12 and under, who are also not vaccinated at this time. Next slide, please. And so that new order that I mentioned earlier on the masks is that masks are required indoors regardless of vaccination status. And that came into place at 12:01 a.m. on Tuesday morning. And so that is unless under 2 years of old, medically unable to do so, or hearing impaired. And then the face coverings that are not required when one is in your own residence, obviously, and working in a closed room or office alone. So that alone word is very important because if you have an enclosed office and you work there alone, then you don't have to wear it. But if you work in a cube where you share the airspace with others, then you do have to wear it. And then actively performing on an activity that cannot be done while wearing a face covering, such as actively eating or drinking, swimming or showering in a fitness facility, or obtaining a medical or cosmetic service requiring removal of a face covering. Next slide, please. And so just a reminder, all individuals ages 12 and older are currently eligible for a vaccine in Santa Clara County. So you can visit scfreevax.org, or you can call 211 if you need an appointment and you need to schedule that. We're going to see if we can go back or maybe go through the slideshow again to go back to the screen. But that was, we have several opportunities for you to go and get vaccinated. One of them is we will have an event coming up in Sunnyvale. There we go. At the Sunnyvale Night Clinic at 200 West Washington Avenue. And that's in Sunnyvale, California. And that will be tonight. So after this event, get your family, call your friends. If they have not gotten vaccinated, they can go there tonight from 5 to 10. and get the vaccine at that site tonight. Thank you. Next. And then also we have a site here in the east side of San Jose at the Story Road Hub Service Center, which is located at 1775 Story Road. And that's right next to the Harbor Freight, in between the Cardenas Shopping Center and the Harbor Freight. You just go there under the clock tower. You'll see a clock tower there. You will be able to get not only a vaccine there, Fridays 3 to 7:30 p.m., Saturdays and Sundays 9 to 4, but also testing. So you will have an opportunity to get tested at that site Mondays and Tuesdays, 10 a.m. to 3 p.m., and Fridays, 10 a.m. to 2 p.m. And then these are the entire county vaccination sites for this week. So you'll see that if the locations that I mentioned today with the posts that I just highlighted do not work for you, you have plenty of other opportunities and places that you can go throughout the Santa Clara County. And that is on our website at the sccfreevax.org. You can look this up. I know it's really small today, but it's just for purposes of letting you all know that there is a site next to you and that we have different times and options available for you to get a vaccine. Next slide, please. And then, as promised, it was important to bring information in regards to the cases by age group, and in particularly our younger age group. And so, as we're getting data, this was the data that was available today, as of today, and you will see there the ages 20 and under at the top. That they make up. This is the total number of cases that have that we've had positives in our county. If you see in the case count, that's the total as of when they first started being reported. And in regards to the percentage of the children, it's broken down by age group. It's 18.7 in regards to the 19 and under. And I apologize that it's so small, but I wanted to make sure that I was able to share the entire information with you all, because I know that although most of us are very interested, in the children cases, the other information is also very important to understand, COVID at this time, and who it's affecting. I think some of us, initially thought it was just the elderly that were getting COVID, but unfortunately, if you see in these numbers, most of the cases are actually, the youth. It is affecting our youth. And so, for example, the 39 and under, it's in the 20, so the 30 to 39, it's in the 20,000s. And so important to know the entire numbers and what we're looking at to see the big picture, but also, being able to highlight the children that are getting COVID, that it is affecting our children also. Therefore, it is important to, keep masked and ensure that we're following the orders and we're getting vaxxed. Those that are able to, that we're taking advantage of that opportunity, something that our children, unfortunately, are not able to do so yet. Next slide, please. And so, again, just restating these resources. I do this on a biweekly basis. Important to know phone numbers, sometimes, not for ourselves, but for somebody that we might know. Take down some of these numbers are all very important. The ones that I felt were more important to me and I wanted to highlight today, the COVID support line 808-7770. And you can call there and ask, anything related to COVID. Mental health services, 1-800-704-0900. It's our behavioral health department here for Santa Clara County. You never know. It's definitely hard times for all of us, during this pandemic. We thought we were coming out and then all of a sudden we have a mask mandate. That could be, triggering for some of us, maybe remembering where we were at a year ago. What does this mean? Our little ones, maybe stress, like, does this mean I'm not going to school? And all these things that maybe that might spark up. And then the crisis hotline number, the 20 that's open and available 24 hours, 7 days a week at 1-855-278-4204. Or you can text renew to 741-741. I know some people are better with the texting, so that's also available to you all. Next slide, please. And then the call center, again, available. 211 is our general number. They can send you, to somebody regarding COVID, vaccination, resources. If that's the number you remember, that's great. 211 will get you to the resources you need. And then vaccines, any questions specifically for vaccines at the 408-970-299. Or you can also send a text message to COVID-19 to 211-211. Thank you. Next slide, please. Thank you so much. And with that, I'm going to bring in our first guest for today, Mr. Dr. David Putney, again, who is an administrator of special projects at the Office of the Superintendent at the Santa Clara County Office of Education. He'll be maybe sharing an update in regards to Santa Clara County Office of Education overall. And then after him, we'll bring in Dr. Hilaria Bauer. Thank you, Dr. David Putney. Welcome.
Oh, thank you so much for having me. I appreciate this chance to help support the community. So overview, I can just provide, as many folks know, the California Department of Public Health provides the guidelines and support for schools in the state of California, all private, public, and charter schools. They updated their guidelines July 12th, and then just most recently refreshed it August 2nd with some additional clarifications around quarantining and also the mask, the benefit of the mask and the expectation for masks. In general, the guidelines pretty straightforward in terms of 15 specific areas that schools need to adhere to. I'm not going to go over all 15. I will highlight a couple of the large ones. They're all the same mitigation strategies that we've been using the entire pandemic. There's a huge focus on primarily masking. It's the expectation that all students and staff and visitors and support staff would be wearing masks indoors in all schools. Outdoors, it's allowed to have to not wear masks. Now, it's important to remember that each local school jurisdiction can impose additional restrictions if they choose to. They just are not allowed to have less prescriptive support or guidelines. The primary guidelines, again, are masks indoors. Physical distancing is encouraged, but it does not prevent schools from full enrollment. The science illustrates that masking is as effective, if not more effective, than social distancing. And so the refocus on in-person instruction is the priority of the state of California, and CDPH illustrates the science that supports that. Ventilation recommendations are to continue to improve ventilation systems. MERV 13 is recommended to just ensure that the air circulation is effective. The recommendations for staying home when individuals are not feeling well and are sick, and that also that they would get tested if they've been exposed to COVID-19. Individuals that are in the school setting that come into a close contact, the CDPH has developed a modified quarantine period. And this is really important to help support students stay in school. When individuals wear their masks in school, if there's a positive case on campus, the science has shown that individuals could continue to stay in school settings and then have routine testing after a potential exposure to ensure that they would be able to be monitored in the event that they contracted COVID-19. So, for example, if there's a positive case in a school and the school is adhering to the expectation of wearing masks indoors, the students and the staff would be able to maintain enrollment and attendance in the school daily setting, and only the positive case person would be expected to isolate at home during that period of time. During the modified quarantine period, students would be expected to just focus on their in-person studies, and they would not be allowed to have any of the extracurricular activities, after school, and other activities. The intent is to really prioritize in-person instruction and to keep schools open and keep students in in-person instruction for all the right reasons. It's really the best place for our youngsters to learn. In individuals that are fully vaccinated, they would not need to quarantine. Currently, they would just need to monitor for symptoms of COVID-19. And in the event that they became symptomatic, then they'd be expected to then quarantine and test immediately. And if they were positive, then isolate and complete their 10-day isolation period. The update also increases some clarifications around isolation recommendations, aligning with CDC isolation requirements. It focuses again on hygiene recommendations to continue to promote good hygiene, washing, sanitation. Cleaning recommendations have been updated that routine, regular cleaning in the normal, traditional way is very effective. In the event that there's a positive case on campus, then the schools would be expected to do more thorough cleaning, high-touch surfaces, etc. And then there's just additional reminders that CDPH will continue to update the guidelines as more information becomes available. And we are also waiting for additional clarifications from CDPH for updates on programs serving children and youth, which would be your child care programs, as well as your after-school programs and your camps. And athletics, we're still waiting for an update from CDPH to give us some more information on the athletic guidance is expected. And we are also waiting for additional clarification information for band and performing arts. With band and singing, performing arts, those do generate more aerosol, which is the air particles, the moisture particles in our breath. And so we're waiting for additional guidance for this school year. We're expecting that will come out very, very soon. And then when we get that information, we will share it with all the schools in the county. Speaking which, I think it's nice to share with the community that our Santa Clara County Office of Education, under the direction of our superintendent, Dr. Marianne DeWan, has really developed a coordinated system of communication and support for all schools, public, private, and charter, where we meet with regular teams to support and provide the information that's updated to ensure each school has that support to maintain full in-person instruction. And that's been just a wonderful coordination over the course of this very challenging pandemic. Those are the primary overarching updates from CDPH. I'm not sure, Karina, do you have specific questions or things that we should address? Or
Thank you so much, David. Yeah, we have several questions. However, I know we have another guest. So what I'm going to do is we'll have an update with her specifically to her district, and then we'll go into the questions from our audience. So remember, audience, I'm going to be covering the questions related to today's topic. We do have Dr. David Putney, and we do have a superintendent here who I'm going to be bringing in soon, Dr. Hilaria Bauer, who is our superintendent for the Alum Rock Union Elementary School District. Welcome, Dr. Hilaria Bauer. And then after she gives a general update about her district, then we'll go into any questions and answers in regards to, again, today's topic. I do already see some of the questions on there. So, I'm going to remind folks to, make sure to keep them appropriate and, focused so that we can get through as much. I'm hoping that we get through all of them. Thank you. Welcome, Dr. Hilaria Bauer. And we have you on mute, so we can unmute.
Thank you so much, and I just want to say hi, David. David made my job a lot easier because he covered all of the main points that people need to remember. And I think that what we want is to have the best possible in-person experience for every child in the county. That's our goal as educators. And we are working together to make sure that we have the safest environment in the classroom. The best place for a child to be learning is in the classroom. And we are in Alum Rock, and I know in the rest of the districts in our county, we're all working very hard to make sure that as we open our doors to welcome every single student, we are ready with that very safe environment. And so I guess what I would like to highlight is that parents need to be great partners with us, helping us manage some of the feelings that students are going to be, feeling that first day of class, those first few days. They've been Those who have already some schooling, they have been out for almost 18 months, except for those who came back for the reopening. And also for the very little ones, the very young ones, the TKs, the young fours, kinder, those who are coming the very first time, we really need parents to support and help us mitigate a little bit of the anxiety that is natural when we start school. So parents, very important to develop a mask habit. We're calling it in Alum Rock the number one tool that we have in our schools for those of us whose students don't have a vaccine yet. The number one tool to prevent the spread of the contagion is to wear a mask. And we need to develop a habit. The way we tell them to wash their hands, the way we tell children you gotta brush your teeth, does the same thing with the mask, right? The mask is going to prevent us to get germs, so that we won't get sick. And we need to talk to children with the facts, right? It's very important to be truthful, calm, telling them, we want to make sure that you're safe. We want to make sure that when you feel like your friend was to give you his hand or her hand, not this time. Those are habits that we really need to develop in our students, especially the very young ones, to keep them protected. Alum Rock is going to it's implementing a multi-layer safety protocol, which is a little bit more rigorous than what is required by the public health department, just because we want to add an extra layer of protection for all of our students. We are going to have some level of physical distancing of 2 to 3 feet. We are going to practice that also in the buses for our special ed students that are going to be coming to us. We will have, wherever we're able to, keep the sneeze screens that we put on the desks. We're going to continue to have those just to make sure that children learn where their boundaries are. Because even though we know that the science says, well, they really don't help, they help the child visualize, okay, here is your area where you are able to work. So we're trying to use some of the things that we have learned. Alum Rock started with care pods for students who needed a safe place to study since last September in 2020. So we have learned a lot of different things about how to implement a safe learning environment. We implemented the learnings during our reopening and also during our summer programming. And I'm happy to report that Alum Rock did not have any contagion in our schools. And that was amazing. The cases where we had a contact that, sometimes that happens, somebody contacted somewhere else at home with family, and those things happen. We immediately went into quarantine mode and we learned how to kind of stabilize the system and follow the protocols. Dr. Putney mentioned the modified quarantine. Alum Rock is going to be a little bit more rigorous than that, just to add that extra layer of protection. Even though the health department allows for just that one person to be aside or away quarantining, we're still working with our nurses, just to kind of monitor the contagion in our community. Please remember that every community is different. And so whatever applies to Alum Rock may not apply in Morgan Hill or in Gilroy. And it's just the way our community works. So please check with your school district. Those of us in Alum Rock, call us and we will be happy to provide the information that you need, because our number one goal is for your child to be safe and to learn. Thank you, Corina.
Thank you so much, Dr. Hilaria Bauer. And now we're going to open it up to questions. And so I do my best to go through all of them. Some that might not pertain. Depending on the time, I'll come back to those. But and I'm going to start.
Oh, sorry, really quickly. I just want to appreciate, Dr. Bauer, that you are showing how each local community needs to refine the guidance for your local community, and schools can add in additional layers of protection and mitigation. So that was beautiful. I'm really proud of the work you're doing in Alum Rock. And again, that was just a great example of how local control is really their local educational agency to serve their local community.
Thank you so much. And before we go on to the questions, I do want to highlight, thank you both for your leadership in, Santa Clara County Office of Education, Dr. David Putney and Dr. Bauer there at Alum Rock, and all the other leaders doing, our job, which, when things change, as we all know, right, in the moment, and then shifting in the moment, it's not easy. And so, as much as, we get noise and we get, people, maybe it feels like getting tomatoes thrown at sometimes, right? I think that's a great thing that's happening. I love when that's happening, when people don't agree, when people are upset, when people, have something to say, whether it's good or not good. That means that our community is being involved, that our community is listening, that our community is voicing their thoughts and opinions, which is, why we're in this such great country and county that we're able to do that. So welcome again. And so I'm going to go into Michelle Yees first, who is joining us through YouTube. Welcome. I see, can we have CC? And Michelle, I'm not sure what you mean in regards to CC. I know what CC means to me. So if you can please maybe write that out in a question moving forward, and we can hopefully answer that for you. We have Chris Mendez. Wonder when they put limits on size gatherings. And he's given examples of different gatherings. I'm assuming he's wondering when we are, as a county, going to put limits on size of gatherings. And really, Chris, that's what we're trying to prevent. We are not trying to go back to putting any more limits. I think we've all had, are done with limits. Nobody wants to put any additional limits. Therefore, the mask mandate was put into place on Monday to prevent us from going there. Thank you for joining us, Chris. And we have Robin, who is asking, what is the guidance on social distancing at school for minors? David, can you?
Yeah, overall, and this is another example of local control and kind of structured support from California Department of Public Health. There is no social distancing minimum or standard from CDPH. The expectation is that the masking is indoor expectations for all. And when that's used, then the social distancing it's not necessary for classrooms. Now it's encouraged that people would have more distance when you can, maybe outside, when you're eating, 6 feet apart, when you're eating or doing other activities. Those are general best practices that we've been using, but there is no specific social distancing requirement in the school guidelines currently.
Dr. Bauer, do you want to answer that for Alum Rock?
For Alum Rock, we will be implementing a 2 to 3 feet in the classroom to make sure that students know what their boundaries are. It's very important for children to know, what is the place where they can, kind of move around, just because they're children and we serve the youngest ones. And the same as Dr. Putney said, we will be implementing physical distancing during lunchtime, and we are getting ready to have extra, the students are going to be eating outside, some of them in the cafeteria, depending, every cafeteria has a different dimension, and I'm pretty sure that applies across the county. So we are getting ready to implement that. Students will be also following physical distancing in Alum Rock in the bus. We want to make sure that even when we are driving a bus with the windows lower and everything, there's also some level of distancing just to prevent, the contagion.
Okay, thank you. And we have Sean here who's asking, what are the options for those who are vaccinated who can't physically wear a mask due to medical condition? Great question, Sean. And as I mentioned earlier in the presentation, those are medically unable to do so. That is one of the areas that we're allowing for, for those. And obviously, you will have a doctor's note and all that. If you are one of those, you know exactly what you need to do in the guidance from your doctor. And so that's also taken into consideration. Thank you for that question. And we have Sukanya here. Slide is not clear either. So please, Sukanya, if there's something that wasn't too clear, make sure you put your question in there to ensure that we answer any question you might have. We have Carl here. Why are we opening elementary schools then? And I think Carl put this question when one of you were presenting.
But ultimately, where state of California and California Department of Public Health is really aligning with the science that it's safe to be in school settings. The transmission of COVID in school settings across the country has been extremely low, as Dr. Bauer illustrated, that the transmission on campus did not occur in her school district. Now, individuals were exposed in their communities and maybe got it at a social event or some other activity and then came to school with it. But the transmission does not occur. In rare cases, it does occur, but it's very low transmission in school. So the focus is to get schools back open because the positive outweighs the risk factor, and students need to be back in community and in person for their social, emotional, mental health and their academic learning. And that is why it's being prioritized.
Thank you. And then Dr. Putney, we have Rachel here who's asking, do these apply for private schools?
Yes, all schools are under that guidance of California Department of Public Health. I believe that's a constitutional state constitutional provision. So all public, private, and charter schools are under those guidelines. And here in Santa Clara County, we're working with all the leaders and heads of schools for all the schools to ensure they have that support to understand how to implement the guidelines.
Thank you. And then we have Sean, who's asking, show us unaltered, uncommitted, peer-reviewed data. Happy to do so, Sean. We do our best to respond. So please put on there what kind of data you want to see. And I will do my best in gathering that data and bringing it back at the next community forum. Thank you for joining us. We have Lilia Jacobo. What guidelines will there be in SDC special day classes? These kids are not only have medical underlying conditions, but high risk as well?
That's a great question. Students, individuals with exceptional needs, medically fragile, those individuals would be under the care of their physicians, to be working with their special day teachers through the IEP process to ensure that their medical needs are being met and implemented in the school setting. There's alternatives to masking that are also effective. So it's going to be individualized, just like all the services for students with exceptional needs. And so it's hard to answer the question in general. If you have a child with exceptional needs, I would encourage you to contact their case manager, their special education teacher, and ask those very important questions. We here at Santa Clara County provide one of the greatest collection of specialized programs for students with medical fragile, as an example, deaf or hard of hearing, additional adults, young adults with additional support. And it's just very individualized. So in general, there are alternatives to masking and some of the other provisions, but it needs to be in consultation with the medical community to ensure they're safe.
Thank you. And then we have Bina Kana here. When can I get a booster shot in Santa Clara County? San Francisco approved booster shots for those that got J&J vaccine and who are immunocompromised. And thank you, Bina, for that good question. And here in our county, we follow the vaccination guidelines set by the FDA's emergency use authorization, which does not currently include authorization for a supplemental dose. So that's where we are at as a county. Thank you for tuning in. And we have Susel Vera. Are attendance requirements going to be lower this year to account for staying home when sick until tested?
Great question. I think the expectation of the students would be attending regularly. The state of California is prioritizing and funded public schools to ensure 180 days of instruction. I think if an individual is out due to illness, due to COVID, obviously that's a legitimate illness and that would be appropriate. Attendance, individuals that miss a lot of school get a lot of support through the SART process, Student Attendance Review Team, and would again individualize the support, what is necessary. Students that miss a lot of school would be considered a chronic absent student, but we'll all be looking through the lens of COVID-19. And if it's related to COVID-19 due to having to be out, the school districts will work with you directly on that. Individuals that would miss a lot of time, there'll be, I'm sure, a lot of what is it? It's learning loss mitigation strategies, different support systems that keep students caught up, either through different support systems. So it's, in general, everyone is really working hard to ensure that kids come back to school regularly, and individuals that are missing school due to COVID-19 would not be inadvertently penalized for that. It would be a circumstance of just the pandemic.
Thank you. And I think the next question relates to that a little bit. We have Addie here who says, so if a student tests positive, they can still go to school in person, or am I confused?
Yeah, great question. No, it's a student or a staff member or anyone that tests positive needs to isolate immediately and stay home. There to then monitor their symptoms and stay healthy, stay away from other individuals, wear a mask at home to protect your loved ones and family members. Anyone around you would be a close contact, and they would need to be quarantining while that individual is in their isolation period, which is normally 10 days, as long as symptoms are subsiding and there's no fever after the 10th day for at least 24 hours. At that point, the student or the staff member could come back to school, would not need a note from a doctor, does not need a test for COVID after they complete their isolation period. That is allowable. Matter of fact, if they went back to get retested, they would still show positive. So the test is not necessary. And we don't want to impact our pediatricians or our doctors after the 10-day isolation period has completed. If you have more serious symptoms of COVID, that's different. Then we'd want to support you to reach out to your medical community. But for the average person that goes through the 10-day isolation period, that should be sufficient. The close contacts around the positive case at school, if they're fully masked, can have a modified quarantine where they would stay at their school setting. They would test at least twice within 10 days. The recommendation is to test immediately, and then again after day 6, and then again day 8, just to ensure. So the guidelines identify 2 days essential. The best practices would be 3. Test immediately, then test 5-day, day 8, and if at that point, then the individual would be able to maintain their enrollment in their daily instructional program. They would be expected to not participate in after-school activities or athletics or other activities in the event that they were positive. We're just trying to focus in on prioritizing in-person instruction. I know it's kind of complicated when you look at the modified. If you'd like to know more, I'd encourage you to go to the CDPH, that's California Department of Public Health's guidelines for schools, and read it for yourself, because that way it does a good job of answering. There's also an FAQ sheet that gives you more information about that. And you can, again, find that at the California Department of Public Health, or email us here at the Santa Clara County EOC, and we'll send it to you also.
David, can you repeat that email again, the CDPH?
They have the
website.
Ours through the county?
The CDPH website.
The CD, yeah, is that chat live?
Yeah, I can put a banner just to make sure that people are able to get that. So if you can just, you can send it to me or put it on there. Either way, I'll make sure to put it on the screen. Thank you so much.
Yeah, it's basically cdph.ca.gov is their main site. And from there, you can scroll to their updates. It's very user-friendly. So cdph.ca.gov.
Great. So there it is on the screen. In case you didn't get that, make sure to write that down and get the updates as they come out. Thank you, Dr. Putney. All right. And now we'll go on to our next comment here. Question: why no online learning? My child is at SJUSD. She has asthma, which makes her high risk. How is she going to be safe in PE? And then she has other examples. So I guess her main question is why no online learning this year?
The intent by the CDPH was to ensure that in-person instruction would be prioritized. There is a lot of additional support to do that. I would encourage, if you feel that your local school district is not supporting you, I'd encourage you to reach out directly to your local school district. There is alternatives. Independent study is a model that is available for students. But again, in-person instruction is really in the best interest of the student. And transmission of COVID-19 in our schools is very low, minimal to none. Even here in Santa Clara County, we've monitored and investigated every case of COVID in our schools, and it's extremely, extremely low if you consider the number of students in our school environments. The risk is greater in other social settings. But again, each school district has to provide that support for your in-person instruction and then alternatives. So if you and your child feel that there needs to be an alternative, I'd encourage you to reach out directly to your local school district.
Thank you so much. And then we have some comments around people's thoughts and opinions around people being quarantined and singing in churches. Again, right now, the only mandate is the masks indoors, unless you're medically not able to do that. That is the only current mandate that's been updated in our county. No mandates around singing in churches or anything like that. We have Lickbin Koo here, who says, what data do you have that shows it is safe for kids to be in school in the middle of Delta surge?
There are studies that are available on the CDC website that speaks to, from the Center of Disease Control, has recent research. I'll be honest, I'm not sure to the degree it relates to the current Delta. I know that the Delta variant was active in other parts of the world prior to really getting a stronghold here in the United States. I'm not sure of current research specific to the Delta. I'm sorry.
Thank you. And then we have Addie. How will we test students and teachers? Will this be a weekly thing? And I'm assuming, David, this will be different per district, correct?
Yes, the state of California has provided support for all schools, public, private, and charter, to provide free testing that's available for all school districts. The guidelines currently does not mandate a routine testing cycle, but recommends different cadence, meaning frequency of testing based on high transmission or low transmission rates in your localized community. So school districts are getting that support, and they will each then provide and make decisions on what best meets their need. Many schools currently have that from this last year, and many schools were testing on a weekly basis, a percentage of their staff. But I would encourage you to reach out to your local school district and ask what your district is doing around testing.
Thank you. And I just want to, let the general community members know that, in regards to businesses, there is a mandate for employees to have a list of everybody that is vaccinated, and those that are not vaccinated, that do have to test on a weekly basis. I've also now seen certain businesses, and this is, again, just general, not school related, businesses mandating vaccines for their specific businesses. Again, it's just something that we're starting to see. Also, I saw a business asking for folks to have their vaccine in order to even come into their business. And so, it kind of reminds me of those businesses where you see that if you don't have a shirt, then you won't get a service or whatever. I guess when you have a business, then who comes through your doors, depending on what kind of business it is. So anyways, all that to say that currently, people that are not vaccinated will be testing in businesses here in our county. And not that school districts are businesses, but they are entities. And so, like, even the county, as a county employee, I either need to have my vaccine, and if I don't, I need to test once a week. Okay, thank you. And then we have Jacob Smith. Patricia Andrade, do you know the people in this video? Oh, welcome. If you don't know us, Jacob, my name is Corina Herrera Loera. We have Dr. David Putney here and Dr. Hilaria Bauer. Lori, no cases because there was no health screening. All right. Trying to get through the questions here before it ends. At that time, in Alum Rock, class sizes were extremely limited, only 10 per class. What happens when the class size goes up to 30 students per class per period? Dr. Bauer?
Well, we have had, as I mentioned, an additional protection with more things in place than we are required to do. And so we are very, we know that there's always ways in which things may not go the way we want them to go. But when you add extra protections for everybody, we know that our students, our staff is going to be safe. There is no social distancing requirement anymore. As long as we wear a mask, we are asking that that's going to be implemented in our district. And remember, this conversation is countywide, and I'm just giving something that is very specific to Alum Rock. We know that there's all kinds of questions specific to Alum Rock, and we will be able to answer those for Alum Rock and for Alum Rock families. I don't want to mislead anybody saying, well, the county conversation said this, and it is something specifically to a school district. So I would be happy to take that question as a superintendent offline so that we can talk about that and really continue the conversation regarding countywide topics.
Thank you so much. Okay, we have Rosemary, who's asking, with this new Delta virus, what guarantees you have they will be safe? Wearing a mask all day is hard for a child. Why don't you cut the school hours or days? It just seems children protected all year from COVID. Now you're sacrificing them during this new outbreak.
These are very challenging times. Public health science communities working to consistently reevaluate the data. They're putting it through the lens of meeting students and children's needs and our community's safety. So I know that they're doing their best to provide the most up-to-date guidance possible. California Department of Education and CDPH work close hand to hand to ensure that schools can reopen safely to the best of our ability. And the mitigation strategies still work against the variant Delta, with masking is really effective, and ventilation and the social distancing as an add-on and other strategies are effective to decrease transmission. So we're doing our best. I know there are thousands of professionals in our state, wonderful state of California, that's working so hard to ensure communication is consistent. And they're going to continue to refine the guidance based on the science and what they learn based on transmission. So we'll just continue to do the best we can.
Thank you. Let's see. Our next question is regarding events for school communities, such as trunk or treat, walkathons. And so maybe I'll just take this on real quick. Would it be safe to hold school community events if they are masked and outdoors? Yes, that is what we are encouraging currently. It's outdoors and wear masks. That is not a mandate. The mandate is for indoors. However, if we all wear our masks outdoors, we will be even more safe. So yes, that is safe. All right, and we have Rachel. Will teachers, faculty, and staff be mandated to get vaccinated if health permits? And I think that Dr. Bauer kind of alluded to that a little while ago, where there's different unions involved and conversations, and so maybe take that question to your specific superintendent, as Dr. Bauer just opened her door. Feel free to give her a call, send her an email with any questions, and then any of your superintendents in your specific school districts. And Michelle, thank you so much. Closed captions. Yes, thank you for that. And I will go back to include those to hopefully have it once we load them up and we're not live. We have Luis Bacia. Opening things up was a mistake. Thank you for your thoughts. And why will parent volunteers be allowed back on school campuses?
The guidelines specifically speak to volunteers. Each school needs to make that decision around if it's necessary. The language for volunteers is really around, is it essential or non-essential visitors? So I think I would encourage you to contact your local school and see what they need. Some schools rely on visitors to run the routines of their school. Some of the smaller schools or private schools or charter schools or elementary schools really rely on volunteers. If it's essential, it's allowable, and they'd be expected to follow the same safety precautions. But again, that's going to be individualized by each of your school districts.
Thank you. And we have Claire. Will students be going off campus at all? For example, on field trips?
It's allowed. It would be the normal operations of school. So the schools would, again, follow all the same precautions. I know that there's questions recently, would students be allowed to go other places? Would they be expected to wear masks other places? Absolutely. So wherever they go on a field trip would be an extension of the school, and they'd be expected to follow all the same protocols that the school would have in place in those other settings. But those are very important learning experiences, and we want our students to have those.
Thank you. And then this is more towards CDC, and none of us here are representing CDC, but I'll ask him. I think Daria asks, do you think so? Maybe your thoughts on why is CDC not recommending cohorting within the classrooms? Do you think schools should cohort within the classroom? As an example, a child sitting with 4 kids and do their activities with those 4 primarily rather than freely interacting with 20?
Cohorting is wonderful when the space and the enrollment size permits, but schools are wide variations around our county and the state. And so some school settings have different facilities that would allow that spacing. And so CDC or CDPH or locally here, Santa Clara County, it's difficult for us to give specific guidelines to those aspects. So cohorting is encouraged if you're able to do it. If you are, wonderful. If not, there's other mitigation strategies that can help prevent the spread of COVID.
Thank you. And we have Ophelia joining us. This is wonderful. Thank you so much, Ophelia, for joining us. And then we have a question from Sally. What is Plan B if masking alone does not prevent outbreaks in schools? Will class sizes be reduced and days shortened?
Well, I think that's a great question. And I think as history has shown us, when we have new information, we retool, we redevelop. New science guidelines will come in, we'll reorganize, we'll see what other things we need to do. I know that schools are expected to provide other learning loss strategies. So I hope we don't need them, but I'm confident that our team through the state and connected with our CDC and CDPH that will retool and implement new strategies as necessary.
Thank you.
And I think this is a great conversation. And I just want to remind all of us that this is, although we have a Delta outbreak, right, of the variant and stuff like that, and we're very aware of that, we are ahead in terms of knowing how to deal with a virus. I think that is something we did not know in March of 2020. We did not know in the summer of 2020, right, when a lot of this anxiety was built and it is just increased. But we are now in 2021, and we know there is one for sure antidote against the virus, which is the vaccine. That's why we want to encourage everybody who's able to get vaccinated, number one. Number two, we know that the mask works, right, to prevent contagion. So if we all learn how to do that, how to make sure that we are disciplined enough to be wearing the mask, and I'm speaking as someone who I had to get used to this, right? I had to be able to say, here is my mask. I'm not going to leave in my office without my mask. I'm going to be able to interact with other people with my mask. I think that we all can make this happen. We know a lot more today than we knew a year ago. So I think that is something that we, as educators, as an educator, I feel more reassured, welcoming staff and students in the classroom. We know a lot more about the virus than we knew back then. So let's work together so that we can create the best possible learning experience for our students. We know the best way for a student to learn is to have a teacher in front of them teaching them. We know that. No machine is going to ever replace a teacher. So I'm encouraging public, Santa Clara County, let's mask up and come back to class.
Thank you, Dr. Bauer.
So well said.
Yes, and I do want to just let the community know that I know we have several questions and comments still in the list here, and know that this is a topic that all of us, especially those of us who have children in schools, are very interested in learning more about. So know that we'll probably have our speakers or other school community speakers and guests on our community forum in the upcoming months, especially as school opens up. So we'll go with, I know Pete asked a question about the field trips, and I know we answered that. So I'm going to go to the next question. Is this low transmission in school data based on the Delta variant or other strains that were less transmissible?
There's been countless studies. I'm not sure the current research around the Delta. The Delta variant. I do know that CDPH and CDC does publish those studies. So I would reach out to both of those websites and dig deeper. I don't have one to refer to you right now. I'm sorry.
Thank you. And then we have NY who's asking, are we mandating that all teachers and school staff are double vaccinated? Would this apply to paramilitaries? So that is not a recommendation or a mandate in our county. That is not a mandate in our county. We are not mandating that all teachers, school staff are double vaccinated. And this does not apply to anyone in our Santa Clara County. Currently, at least, what happens when multiple students or staff at a site get the virus? This is not an if question, but when.
All cases that occur on campus would be reported through the California Department of Public Health SPOT. It's a portal there. We just did some additional training for each school, has its own designee. The individual would then upload the information, and then our local health jurisdiction, Santa Clara County Public Health Team, we have contact tracers, which is a team of professional health professionals that would then follow each of the cases and intervene with the families and follow up to monitor to what degree transmission is occurring. And then we would be communicating directly with the school staff to ensure if anything needs to occur at the school site. So I know there's threshold levels that if there was additional cases spreading in a school, then the school might have classrooms closed as necessary. And public health would be working directly with that school through the entire process and the families to ensure that individuals would be isolating if they were ill, quarantine if they were exposed, or the modified quarantine period, and then working with the school administration to move through that process.
Great. And I'm going to go ahead and ask our last question, since we are going to be ending here at 3:30. From Jay, I'm going to say Jay, is surveillance weekly COVID testing in schools recommended, both for students and staff? It is my understanding that Los Angeles Unified will be requiring it.
Routine surveillance testing is very helpful. The state is providing support for each school. Each school each school district has their local decision on how they would implement if they choose to, and the state is funding it. So I would reach out to your local school and ask them their level of routine surveillance testing. It has been a recommended best practice. Great.
And with that, any last words before we close up, Dr. David Putney? I'm going to get together with you and do our best in answering these questions on the comment. So those people that tuned in, thank you so much to all of you. And I want to make sure that we get to your questions. So we'll do that offline. But any last comments we'll open it up to you, Dr. David Putney, and then Dr. Bauer.
Well, I really appreciate everyone doing their part. Thank you, Karina, for bringing this together in this format. Thank you for all those that are, engaging in the conversation and sharing your views. We're working through this together as a community. So if you have questions, please reach out and ask. Help your local community by being involved and being part of the solution. Let's mask up, let's vaccinate up, and let's get through this together.
Thank you, Dr. Bauer.
Ditto.
Yes, absolutely. And we'll see you in 2 weeks when we have our doctor here to talk more about the vaccines. And I'm sure maybe 2 weeks after that, we'll have another school community forum subject, since we have so much participation and so many questions as we open up our schools. Have a great 2 weeks, and we'll see you then. Take care. Stay masked.